When you go to the dentist, you expect to walk out feeling better, right? But what happens when that's not the case? In this explainer, we're going to dive into dental negligence claims right here in Scotland and what you need to know about your rights when treatment goes wrong.
So, let me ask you something straight up. Have you ever left that dentist chair with a nagging feeling that the treatment you just got, that it might have actually made things worse? It's a really important question to ask yourself if something just doesn't feel right.
Now, let's be clear. The vast majority of dental care in this country is fantastic. It's safe, it's competent, but sometimes things do go wrong. And in those moments, you've got to understand the difference between just an unlucky outcome and actual negligence.
When something doesn't go to plan, it's so easy to just chalk it up to bad luck or think, well, every procedure has risks. But here's the thing. Sometimes it's not bad luck at all. It could be negligence, which is a very specific failure in the standard of care that you are absolutely entitled to by law.
So, what does negligence actually mean when we're talking about dentistry? Let's break it down and look at some of the most common ways it can happen.
First on the list, extraction errors. Pulling a tooth sounds routine, but it can go seriously wrong. We're talking about things like damage to the healthy teeth next door, jaw fractures, or even having bits of the tooth root pushed up into your sinuses. These aren't just oops moments. They can be the result of someone not following the proper standard of care.
Okay, this next one is incredibly serious. Nerve damage. During certain procedures, especially things like wisdom tooth removal, there are major nerves at risk, the inferior alveolar or the lingual nerve. If the technique is negligent, the damage can lead to permanent numbness, a constant tingling sensation, or even chronic pain that messes with how you eat, drink, and speak. It's truly life-altering stuff.
And it's not just surgery. Even orthodontic treatment, braces, can be negligent. And I'm not just talking about your teeth not being perfectly straight at the end. We're talking about serious issues like root resorption, where the roots of your teeth actually get shorter because the treatment wasn't monitored correctly. Or imagine starting braces without first treating underlying gum disease. That's a recipe for disaster. All right, what about restorative work like implants and crowns? Well, negligence can pop up here too. For example, an implant could fail simply because the dentist never bothered to check if you had enough bone to support it in the first place. Or maybe you got a crown that just doesn't fit right, throwing off your bite and causing a domino effect of damage to your other teeth.
And finally, maybe the most critical one of all, the failure to diagnose. This isn't about what a dentist did, but about what they missed. A dentist who keeps overlooking the clear signs of advancing gum disease until it's too late and you lose teeth, that could be negligence. And even more seriously, failing to spot a suspicious lesion that turns out to be oral cancer, that is a massive departure from the standard of care.
Okay, so we've seen what can go wrong. Now let's get into the legal side of things, the framework that's there to protect you. Here in Scotland, your rights are actually defined by some very specific legal tests.
Right. The absolute bedrock of any negligence claim in Scotland is something called the Hunter v. Hanley test. Now, this isn't about expecting perfection from your dentist. The law is realistic. It measures the care you got against the standard of a reasonably skilled dentist using ordinary care. So to win a claim, you have to prove that the mistake made was so off base that no competent dentist in that same situation would have done it.
But listen, the quality of the actual dental work? That's only half the battle. There's another huge question you have to ask. Were you actually told about the risks before you agreed to anything?
This is where a huge, game-changing legal case from 2015 called Montgomery comes in. The law is now crystal clear on this. Your dentist has to tell you about any material risks. So what's a material risk? Simple. It's any risk that a reasonable person in your shoes would want to know about before they make a decision. So consent is no longer just about you signing a form, it's about you being a fully informed partner in your own healthcare.
So, we've talked about what negligence is and what your rights are. Now, let's get practical. How do you actually go about making a claim? What does that path look like?
Well, the first thing you need to figure out is whether your treatment was NHS or private, because that changes who you're up against. For NHS treatment, your claim is handled by a state-backed body. But if you were a private patient, the claim is against the practice itself, and it's the private professional insurance that gets involved. It's a key difference.
The process itself follows a pretty clear roadmap. Step 1, and this is the most important, is to talk to a specialist solicitor. They'll help you get your dental records. That's your key evidence. Then they'll get an independent dental expert to look at everything and give their opinion on whether your case is strong. It's only after all that groundwork is done that a formal claim actually kicks off.
So you might be thinking, why go through all this?
What's the end goal? Well, it's about getting compensation, for sure, but it's also about a sense of justice, and crucially, getting the funds you need to actually fix the problem.
In Scotland, compensation is basically split into two pots. The first is called solatium. That's the legal term for the money you get for your pain, your suffering, and how this has impacted your life. The second pot is called special damages, and that covers all your financial losses, like lost wages, or, importantly, the cost of any corrective treatment.
And here's something that might surprise you. A lot of the time, the biggest chunk of a claim isn't for the pain and suffering you went through at first. It's the money needed to actually fix the damage that was done. And that cost can be eye-watering.
I mean, just to put that into perspective for you, to replace just a single tooth with a proper dental implant can cost upwards of £3,000. Now imagine if the negligence led to you losing several teeth. You can see how the cost of just putting things right can climb incredibly fast.
But, and this is absolutely critical, if you think you might have a claim, you cannot afford to wait. The clock is ticking. In Scotland, there is a strict 3-year time limit to make a claim. That's usually 3 years from the date the treatment happened or from the date you first realized something was wrong. That's why it's so important to get advice as soon as you have concerns.
So we'll end right back where we started. You are legally entitled to a competent standard of dental care. The question you need to ask yourself is simple. Did you get it? And if there's any doubt in your mind, you have every right to find out.